Hi everyone, it's me, Melanie, your IVF nurse. Today's topic is just going to be a brief little touching on, I guess you could say, bad behavior that's going through their fertility journey and they have a bad experience. And it could be with a nurse, it could be with the doctor, it could be with one of the receptionists, and then it is just downhill from there. Now, what I have always found is that in clinics, most people, or everybody I believe, starts off with a clean slate. So you're a brand new patient, you come in and everyone is, or should be, very welcoming and understanding to what your goals are. You meet with a doctor. Whether or not you like the doctor or the doctor's approach is completely independent from what's happening at the clinic and may be the determining factor on whether or not you will continue to work with that clinic or not. If you've chosen that you've liked the doctor and you will continue your journey in that clinic, then your interactions with each department may be, could very well be reflected in how your journey goes. Now, there have been times when I've worked in clinics and patients have waited hours to see the doctor, and by the time the patient sees me, they are so frustrated, or even the doctor will bring me the chart and say, you know what, this patient is a little bit upset, can you please deal with them, you have a special way. And then sometimes it's just a matter of letting you vent. Other times I've seen patients where they have been beyond venting, where they're screaming and yelling, and most times this is over the telephone, or even when patients feel that they could just drop into a clinic. A fertility clinic is not a drop-in center. Most patients that are going there, yes, it's drop-in through cycle monitoring. Even some clinics now are making cycle monitoring as scheduled appointments for blood tests and ultrasound, so you do want to pay close attention to your clinic rules. And then from there, dropping in whenever you feel like it because you have a question really does not cut it, because there are other things that are planned during the day for the nurses or other departments. There could be business meetings, staff meetings, there could be lunch and learns, things that may eventually help how the someone that you want to speak with could be learning something that may help them be able to relate to you better. A lot of the clinics do have educational sessions on compassion and understanding patients and new and improved technologies that are happening in this amazing field of infertility and what the next steps can be. So for you to be dropping in whenever you feel like it, or at the end of the day because you just haven't had the time, well, it may be hard for some people to understand this, but just because the nurses are there during the day doesn't mean that they have responsibilities outside. So clinic hours are clinic hours, and it's important that you understand that. Everybody has to have a mutual respect for everyone. So patient bad behavior is really not tolerated. If you want respect from the staff, you need to also show respect. And trust me, everybody there is out for the same goal, and that's to see you have a successful outcome. And there is a saying that you get more flies with honey than you do with vinegar. And most times you may see that maybe someone's having a bad day, and that's completely understandable. I've seen it over the years many times, but getting to the bottom of it and realizing that everybody has bad days. You don't want to be at the fertility clinic. The nurses, the staff, the doctors, they want to be there because they want to help you. So you do want to keep that in mind when you're going through your journey and your interactions. If there is a time that you're feeling very frustrated and you're emotional, usually there is someone that will be available to listen to you, to hear you vent, to hear the words that you need to say, to help you get through that moment in time, to give you the strength to keep moving forward. So just remember that you really don't want to be burning any bridges. Like I said, you get more flies with honey than you do with vinegar. And it just seems that with the Ontario funded program that a lot of clinics are seeing this type of behavior where anybody's walking in whenever they want without appointments. It seems to be that, a patient walks in without an appointment and then maybe they're not happy with the service that they're getting from either the receptionist or the nurse. But you know what? Maybe you've interrupted their lunch and they're entitled to that. Or maybe you've walked in when they are dealing with, another patient, and that's not to say that your issue is not important. It's just, as I mentioned before, having that common respect for everybody. If you're respectful, then definitely you're going to see that respect returned back to you, and it will make your journey a heck of a lot better and a lot more smoother for you. So I hope you do take these words to heart, and trust me, we do understand, or we can sympathize with you about the journey and the struggles and the frustrations that you are going through. But it is important to understand that clinics are very, very busy. We are trying our best, and just being respectful of the staff as well as other patients that, may not be going through the exact same thing as you, because everybody is there for the same reason. They want to have a baby or they want to expand their family, and the staff is there to help you do that. So as I mentioned before, mutual respect goes a long way. Please feel free to check out my website, www.yourivfnurse.com. Please feel free to email me, yourivfnurse@gmail.com. Thanks for listening.